How do you define health communication in the context of your research?
We've done about 50 interviews
Wow.
with 34 families from 19 countries. It can be scary to go to the doctor when you don't speak the language, but also from the doctor's perspective, how can they help? It's pretty severe postpartum depression. We start talking about mental health, and then a lot of them feel that there are no mental health resources.
Can you provide an overview of the Korean healthcare system?
People have the misconception that if I go to the doctor, the doctor is going to prescribe me something and he's going to get paid for that test or that medication. Also, I wanted to mention about 1차, 2차, 3차. There are different sizes of hospitals and clinics.
How does access to healthcare differ for foreigner and multicultural families in Korea compared to Korean citizens?
Korean social welfare treats them a little bit differently.
So are there any specific healthcare services for foreigners?
The main thing we wanted to figure out was racism, like racial discrimination. And what we found is that it's totally not the case.
Hello everyone, today we have Madeline with us in our podcast. She's from US and she lived here in Korea almost 8 years, and initially she came as a English teacher in Korea, but later she find it not that interesting, so she changed her career. So she started a research project on health communication. So let's welcome her. Could you give a little intro
Sure.
about yourself?
Yeah, so as you mentioned, I've been back and forth in Korea since 2015, and I started as an English teacher, and then kind of in the middle of teaching, I went to Jeonnam language school for a year and 9 months, learned Korean, and then went back to teaching. Then I went back to the US. I worked at a hospital in Koreatown in Los Angeles, and then I applied for graduate school. But before applying for graduate school, I started this research project, which is what we're here to talk about today, right?
So Maddie, can I call you Maddie?
Of course.
Okay. How do you define health communication in the context of your research, and why is it important in the context of healthcare for diverse population in Korea?
Sure. So health communication generally, I think a lot of people don't totally understand what that is. So obviously it's health, like medical field, and also communication, so between people. And it can be kind of healthcare administration in a hospital, like managers or marketing or things like that. And it can also be from one person to another, so like a doctor and a patient, or between family members talking about cancer or something like that. It can be health education in schools. It can be a lot of things. It can also be public policy, so from the government to its population, about different health measures or law or healthcare campaigns against preventing disease, things like that. So it can be a lot of things, and it's super interesting.
Can you give a little overview of your research project?
Of course. So, being interested in health communication and wanting to go into the field as my career, I started in February talking with a friend of mine about should we do a project together, and super interested about foreigners' experience in hospitals in Korea. And we decided to focus on families because a lot of young single people don't go to the hospital as foreigners in Korea. It sounds like you may have some experience with that. So a lot of people who have kids are more likely to go to the hospital, we assumed. And so wanted to make sure all of our participants had actually visited the hospital. So we started talking to families about their experiences, going to mostly to primary care, like small clinics and hospitals for flu, cold type things. So since February, we've done about 50 interviews with 34 families from 19 countries.
It's very diverse.
Yeah. So it's been super, super fun. I'm in the middle of analysis right now. I'm maybe about 70% of the way done with the analysis. But it's been really fun so far. So after doing the analysis, we want to do some statistical testing, do a second round of analysis, and then do a lot of writing. So hopefully turn this into a lot of academic articles to publish. So.
Yeah, as you mentioned, single people don't usually go to hospital. In my case also, I got some health issues, but because I feel a little discomfort in talking with Korean people because they don't speak English usually. So I avoided 2 times, but when it was 3rd time, I took your help to go to hospital, and it was really important to go to hospital.
Sure.
So what motivated you to choose this specific topic for your research?
Yeah, so obviously interested in health communication.
As like you said previously, you mentioned me like you started your research project on your own, not
Right.
It is not like related to your master's program or your study, but you started on your own.
Yeah. So about 6 months ago, maybe 7 months ago, one of my friends and I were reading a book together, and as we were talking about this book, like, oh my gosh, this is so interesting. Oh my gosh, it would be so cool to do something like this in the future. And I don't remember which of us, but one of us was like, oh, like we could just do this right now. Like we could just do it. And that's a good idea. What if we just do it? That's a great idea. And kind of started talking about like this book is called The Spirit Catches You and You Fall Down. It's about immigrants to the US, and one family had a really hard time taking their daughter to an American hospital. And so it talks about like the American doctors struggle to communicate with this family about like their daughter's health because of culture and language and all these kind of things. And so we were talking about, like, this friend also lives in Gwangju. Oh man, like, we think a lot of people in Gwangju face similar problems because of communication issues with their doctors or not feeling confident going to the doctor. Like you mentioned, like, it can be scary to go to the doctor when you don't speak the language. But also from the doctor's perspective, how can they help people who don't speak their language or who don't understand the culture? So kind of because of this book, my friend and I were like talking, oh man, we could do something similar to this. This would be so interesting. This is what I want to do with my career. And my friend's like, let's just do it. So yeah, in February, I came back to kind of make sure that it was viable, like possible. And we got a little bit of funding from the GIC, about 300, not less than $300 US, like 300,000 won. To kind of help us with the project, and then the rest of it was self-funded. So, yeah. But,
can you share some key findings or insights from your research project?
Yeah. So there are a lot because, as I mentioned, we interviewed 34 families for more than 100 hours. So it's a lot of material to work with. So some of the most interesting things right now are related to language, related to like participants' perceptions of the healthcare provider, whether they're a good doctor or it's a good facility, or the doctor understands me or doesn't understand me. Some of it is about like resources in general. Do they understand the Korean healthcare system and how to get help when they need it? Also social welfare issues. Some of it about like mental health care resources, because another subtopic is about like prenatal care, birth, labor, delivery, postnatal care. And a lot of the moms experience pretty severe postpartum depression. And so because of that, we start talking about mental health, and then a lot of them feel that there are no mental health resources. They don't know where to get help. So then that becomes a question about information. How do people find information? And then that circles back to language. So,
can you provide an overview of the Korean healthcare system?
Yeah, so it's pretty complex, as it is in any country. So a lot of people have the misconception that if I go to the doctor is going to prescribe me something and he's going to get paid for that test or that medication. But actually, most doctors are only provided for paid for each consultation. So they are motivated to have a high number of patients in their hospital, but they don't get paid for prescribing you medication. They don't get paid for prescribing like an x-ray or something like that. So just because the doctor suggests a test, it's not necessarily his profit. So there is some...
It just maybe because he's more concerned about health.
Yeah. And some of our participants feel that doctors in Korea overprescribe or over-recommend these treatments because they want to make some profit from our participants as patients, where largely that's not the case. Largely, there are cases where the doctor may get some kind of commission if they work in a very small hospital and they are motivated to suggest certain brands over other brands. But yeah, for the most part, it's not profit-minded.
I think it's the case in India, like if the doctors recommend some particular medicine, So I think they get profit. So
yeah, it depends, but for the most part, that's not true.
That's not the case.
And especially in larger hospitals in Korea, that's never the case because the doctor is on salary, and so they will make the same amount every month, regardless of how many patients they see. In a small clinic, they're motivated to see more patients, but they're not financially motivated to give you more prescriptions or more tests. So, yeah, basically. I mean, also, I wanted to mention about 1차, 2차, 3차.
Yeah.
Yeah, so this is a super important thing, which we can talk about later as well. But there are different sizes of hospitals and clinics. And this is, again, true in majority of countries, but very small clinics have fewer services available.
Okay.
They may be specialized in ENT, so like ear, nose, throat, and they mostly only see like sore throat, cold, like maybe laryngitis or sinusitis or those type of conditions. Yeah, and it might be one doctor or it might be 10 doctors, but it's still a private clinic and it's usually pretty small, and they don't have as many services. But then you're going to have also like general hospitals and then also research hospitals, and then also in Seoul, not in Gwangju, but in Seoul they have bigger than a research hospital, they have like a mega hospital. So in Gwangju we have 2 like research hospitals that are by each of our 2 major universities, Chosun University Hospital and Cheonnam University Hospital. Yeah, I mean, what more do you want to know?
So like you mentioned, like there are 3 different level of hospital. One is like the basic clinic, and then another is like
Yeah.
normal hospital, then another is like research hospitals.
Right. Yeah. So like a level 1 clinic, typically they're not going to have a huge wait time. You go in and you can be seen very quickly. There aren't so many patients. Typically they're not going to speak that much English, and definitely not going to speak any other language outside of maybe English and obviously Korean. At like a level 2, a general hospital, they'll have more departments. A level 1 is just one department. Might be multiple doctors, but anyway, one specialty like ENT or pediatrics or something like that. But a general hospital usually has between 3 and like 20 specialties. And so, okay, you go to this department and they say, oh, actually, you also need treatment from cardiology and you also need treatment from neurology.
They have all facility in the same, like in the in one hospital.
Yeah, and they have more like equipment available, like to get an X-ray or an MRI or, you know, those kind of things. Maybe the doctors speak some English, maybe. Usually nurses, nope. Signs are probably not in English, those kind of things, and they don't have interpreters. But the level 3 hospitals are 2 research ones. They have on-staff interpreters, so it depends on the time of day that you go. But because they are research hospitals, they see like rare cases, like something
for the research work.
Something kind of unique and like. So if you go there and you just have a flu and you're waiting in the emergency room, you're going to be there like 4 hours. I don't recommend you go there.
First go to the level 1 hospital, like normal clinic.
Yeah.
And then maybe if you're recommended, then go to second level hospital.
Yeah. So another thing too, if you're recommended by the doctor, it's not really a prescription, but it's kind of a referral from the level 1 to the level 2. You'll get like a cheaper rate.
Okay, cheaper rate.
Yeah, so it's cheaper to get the referral from the level 1 and be sent to the level 2 than to just go to the level 2 directly. And then to like, for you typically as a patient, it'll be a little more, it'll be faster. If at the level 1 clinic, he's like, oh, it's not a big deal, I can help you. Then it's finished, it's fast, it's easy. If he sends you to the level 2, okay, it's an extra step than if you had just gone directly to the level 2 hospital. But anyway, then you know it's like, legitimate. It's a real reason to go, and it's cheaper. So, yeah.
So, how does access to healthcare differ for foreigner and multicultural families in Korea compared to Korean citizens?
Yeah. So, we wanted to talk about the difference between foreigner and multicultural family because that's important.
Yeah. Okay.
So, I'll introduce that first, and we'll come back to this question.
Sure.
So, I mentioned that I'm not sure if it's kind of a law policy thing in Korea necessarily, but for the purposes of my research, we are defining foreigner families and multicultural families differently. So when I say foreigner families, I mean both parents are not Korean. But when I say multicultural families, I mean one parent is Korean and one parent is a foreigner. And in some cases, these 2 foreign parents are from different countries. So we had some participants where one parent is Korean and one parent is from Ukraine, or one parent is Korean and one parent is from the UK. One parent is from UK and one is from Australia, like that.
Okay.
So, but anyway, both are foreigners, not Koreans. And Korean social welfare treats them a little bit differently.
Okay.
So some social welfare programs or like benefits are only provided to both Korean parents, like totally Korean family, or multicultural family, but some benefits are not provided to both foreign.
Both foreign, okay.
Yeah, and that depends on the province also, because some welfare programs are provided by Korea, the whole country, and some are provided by each province.
Okay,
or
so that
each
differs
city.
based on different provinces.
Yeah, different areas, and just kind of how they structure the budget for social welfare. So, yeah. Also, as I'm doing doing my literature review, I'm working on that for one of the papers, and I found that a lot of statistics about healthcare in Korea are collected from Korean families, which are not part of my research project, or from multicultural families where one parent is Korean and one parent is foreigner, but they are typically not collected for foreign families where both parents are foreigners, even if they're long-term residents. So they've lived in Korea 20 years, but they're not incorporated into the statistics gathered. So for me, that's a really interesting problem, because as Korea's like birth rate is going down and the number of migrants is going up, like shouldn't foreign families also be included in data? If foreign families are not represented in data, like that's a form of discrimination. It's kind of implicit, but it's there. So that's problematic. Yeah, and that's something I only started thinking about like yesterday. So I didn't really realize how absent these foreign families were in research in Korea. So that's a pretty important problem. Also, in my project as a whole, like foreign families and multicultural families are very different. Yeah. Just the ability of these like married to Korean, the people married to Korean, their ability to assimilate looks different. Their motivations for learning Korean are very polarized. And if they learn Korean language, they tend to be very involved in a lot of aspect of raising their kids in Korea. But if they don't learn Korean, a lot of times they rely really heavily on their Korean partner, where foreign couples don't have that option. And so it seems a little more equitable, like they do it a little bit more together than in the multicultural families. Even if these, like the foreigner families don't learn Korean language, they tend to do everything together effectively. Like they take care of the kids together. They take them to school. They take them to the doctor, blah, blah, together. Where these ones either...
One is Korean, one is foreigner. So
a little bit, yeah. So not exclusively, but that's one of the big differences. Yeah. Super interesting.
So what are some common challenges or barriers that foreigner and multicultural families face?
Yeah. So again, some of the barriers are different because one of the biggest barriers is language. I mentioned like something like 100 plus hours of interviews. About 30% of that time was spent talking about language.
Language is the biggest barrier.
Maybe the biggest. So some of them speak very good Korean, but they're still really aware of how language affects their interactions with the doctor or ability to access care. And so even if they speak good Korean, they worry about their ability, or they feel like it's not enough, or they worry about their kids' language ability, or, you know, all these, there are so many different facets of how language affects healthcare. Then the ones who don't speak Korean, especially if they're not motivated to learn Korean, they feel a lot of fear or anxiety, they're nervous, and they're less likely to do what we're calling doctor shopping. So it's very common in Korea to kind of,
change doctor.
Yeah. So whether that's a good thing or not is a completely different question, but people who feel confident in their Korean language ability are much more comfortable like changing doctors. But people who are not confident in their language ability worry about, oh, like, will my next doctor understand me? Will I be able to communicate my symptoms, my medical history, those kind of things? So they are more likely to stay with the same doctor, even if they're not happy with the service that they receive, than someone who's confident in their language abilities.
They are afraid of like communicating again, the like from starting symptoms.
Yeah. So language is one of the biggest things. There are lots of them, but that's definitely the biggest one.
Yeah. Any other?
Yeah, I mean, generally feeling uncomfortable or unsure, uncertain about how the doctor will treat me, or, you know, if I don't like something, what else can I do? Is there a complaint or grievance process? A lot of people had problems, like talked about feeling worried or stressed or those kind of things about labor, childbirth, you know, early childhood vaccines and not being certain about that process. Yeah, a whole lot of them. Am I getting appropriate treatment? Is this over treatment? Am I being too sensitive? Is the doctor being too sensitive? Did they understand me? Like, concerns also about how school treats healthcare, like problems when they send my kid home from school. Like, am I required to do X, Y, and Z? COVID was obviously a huge issue. Yeah.
Also, I think there is a cultural difference. Like in different country, they the person's perception of healthcare system is different. Like in some places, like they are more caring, and some places they are more professional about healthcare system.
Yeah. So this was also something super interesting in the project, in that a lot of people said, yeah, Korean doctors are very cold. For the most part. There were a few people who said, oh, I found one who's not cold, so I want to go to him all the time. But most of them said, he's cold, that's okay. He's cold, but he's efficient. He's cold, but I get the care that I need. So I'm going to keep going there anyway. Like, my home country is not like this, but that's okay. Like, most people are satisfied with Korean healthcare. Everyone said Korean healthcare is better than care in my home country. So some people, for different reasons, a lot of people said it's really cheap, or a lot of people said it's really expensive, but still I prefer, both groups prefer Korean healthcare. Yeah.
Like one of my friend went to a clinic. He has some problem in his leg, and there was some problem in communication, but he just did some sign language, and within a minute, doctor like noticed what is the problem, and he just gave the medicine. Like, he didn't care too much like to communicate about thing, but he just got the idea what is the problem. He just gave medicine, and within a minute it just finished. So I think it's fine. Like,
so another thing I'm really curious too, like the bari culture is like, okay, just in and out. Like, the amount of time that people spend with a doctor here is much shorter than it is in the US. Most of our participants said that same in their home country, they spend more time with a provider, with a doctor or a nurse, than they do in Korea. A few of them said my home country is the same or spends less time with the doctor, but all of them said that's okay, it's enough. Even though the time is so short, I get the care that I need, so it's okay. And again, everyone is satisfied and mostly didn't think more time would help. Mostly. So interesting. Not what I expected to find at all. Like, I thought people would be a little bit at least uncomfortable and maybe dissatisfied, maybe wish for more time. But everyone we talked to said, no, it's enough. Like, I don't need more time. Maybe it was surprising or shocking at first, but once I got used to it, it was fine. Like,
if their problem was like cured, so it's like it's fine. Like, even if it was shorter or longer, it's fine. If they
the ones who felt I didn't get the treatment I needed went doctor shopping. They didn't go back to the same place. So I don't know, that could be an area for future research. Like, why not go back to the same place if you feel like you didn't get the care you needed? A few people did, even though they didn't get care they needed, but for the most part, doctor shopping is the favorite method for dealing with.
I think in my country, so I think it's more of like Asian thing, like to do doctor shopping compared to other Western countries.
I mean, the way American insurance is structured, it's literally not possible. to do.
Okay.
Yeah. So I don't know about other countries so much. It sounds like in kind of UK, Australia, like that, it's also not possible. It sounds like Indonesia, it's possible. China, it's possible.
Even in India, it's possible. Just wherever you want, you can just go.
Yeah. But I think
In Korea also.
yeah, definitely in Korea. I'm not sure about like a few other countries. We didn't talk about that issue so much, so I can't really say, oh, this is Asia versus this is the West. I don't know that, but yeah.
So, are there any specific healthcare services for foreigners?
Yes and no. So there are 2 clinics for migrants that are free. Their target is mostly for uninsured migrants.
Uninsured.
Yeah. So it's very basic primary care held once a week. So the first one is for Russian speakers every Tuesday night in Wolgokdong. And again, it's for Russian speakers. So the doctors there don't speak English, and the interpreters there are there to interpret like Russian and Korean. Anyone can go, and even if you don't have insurance, it's free. It's fine. The other one is on Sundays, and it's mostly Vietnamese, but they also have some other language speakers there as like doctors or volunteers. So again, anyone can go, and the target is for uninsured people, but even if you have insurance, you can just go. It's free. So the one on Tuesday is for Russian speakers, and the one on Sunday is for anyone. And the one on Sunday is in Gwangsang-gu, and the one on Tuesdays is in Wolgokdong. So they're kind of near, but not close to us here in Jeondae.
Yeah.
So it's a little bit far. But those are the 2 like free services for especially uninsured. And then as far as other things, there's nothing specifically for foreigners. There are
it's general like for Korean
anyone.
also. Okay.
Yeah. So obviously there are lots of clinics and blah blah, but usually you have to have insurance for that. So those 2 that I mentioned in Wolgokdong and in Gwangsang-gu, free, don't need insurance, you can just go. But anything else, you kind of need to have insurance in order to access.
But those 2 are like for open for everyone, not specifically like for foreigners.
Actually, they're specifically for foreigners. The one in Gwangsang-gu is specifically for foreigners. Koreans cannot go.
Okay.
The Russian-speaking one, I don't know, actually. I'm not sure. Because I only went one time, so I don't know it very well. The Gwangsang-gu one, no Koreans. No Koreans as patients, I mean. So.
Sometimes I also get some notification or on some Facebook posts like some research institutes, research hospitals, they provide some particular like healthcare things only for foreigners. So I think there are a few things.
Yeah, I know the dental schools in particular have like some events and things like that. Some of the professors work with their students, but I'm not sure how regular those are. So I don't know how, I never participated in that. I know they're free. I know you don't need to have insurance, but I think it's also not like a every week or all year.
I think it's after 2 or 3 months like this.
Yeah. So, but the Wolgokdong and the Gwangsang-gu one, they're always there. They've been there for like 20 years. So.
Yeah, and I think for students who are studying in some university, they have some time-to-time health checkups or something for foreigners free of cost.
So yeah, I'm not so sure about that. So with my participants, obviously they have children, and there are like milestone checkups, kind of wellness checks for infants and children that are kind of required. So they have like a text message alert system that you can register in the guchong, like the gu office, to get text message updates. So they're like, oh, it's time to schedule your baby's 6-month appointment, blah, blah. Up until maybe 7 years old. And then after that, the school will remind the family, like, oh, okay. Like this year you need to, in this month, please go get your child's checkup, blah, blah.
It's a good, like, this is from the school. Like,
yeah. So it starts from the government and then moves to the schools. And then for adults, like foreigners, it kind of depends. So when I was here as a teacher, it was mandatory to renew my visa that I also get a health check. I think for students, it's just when you first arrive, if I understand correctly. Yeah. And then it just depends on like their job or their kind of purpose in Korea. So I know Koryoin or refugees only have to, when they first arrive, then after that it's up to them. but insurance does cover, I believe it's every other year. So one checkup per 2 years for everything.
Okay.
So it kind of just depends on their visa and their purpose in Korea. Some have more frequent requirements. It just depends. Yeah.
Can you share stories or anecdotes from your research that illustrate the challenges and trumps
Yeah.
that foreign families have experienced within the Korean healthcare system?
Yeah, what kind? There are so many. All of them. Well, that's going to take me about 100 hours. So
Whatever comes in your mind, let's
so
discuss.
I guess there are some different types of migrants, different reasons to be in Korea. So some of them got married to a Korean, and so they're on a marriage visa. Some of them came as English teachers or other kind of professional jobs. Some of them as unskilled labor, so working in factory or field or something like that. Some of them came as students.
Yeah.
Some of them came as a refugee, but then kind of overstayed visa, so now they're illegal immigrants, like that. So because of that, they also have a little bit different perception of like their social status in Korea. So some of them are a little more vulnerable to exploitation, or just like dependent on their employer or their like Korean spouse for their visa. It makes them more vulnerable. And so their sense of identity or things like that. So we had one very lovely lady.
Okay.
She's great. And she was very direct with me about how her Korean husband's family basically took her paycheck every month. And she has recently liberated from that situation, but it just took a lot to get out of that situation.
Okay.
She's awesome. She's a very strong person, a very strong-willed person, very determined. So that's like one aspect. Another is that one family from Indonesia came not as marriage migrants, but as workers, and were very dependent on their workplace, but then were not notified that their work visa had expired. And so they were effectively illegal immigrants, but they didn't know. And so they've since appealed to switch to refugee status. And so they're now on refugee visas in order to kind of fight that like illegal work
status.
Yeah. So again, kind of vulnerable, and they don't want to go back to Indonesia, but they don't have a lot of options. So really challenging. Yeah. And then a third person, she's from China. She married a Korean guy, but it did not go well.
Okay.
A little bit unsafe situation. And so she didn't divorce, but she lives separately from him with her son.
Okay.
And also doesn't want to go back to China, but wants her son to kind of grow up here. So quite a few people who marry Koreans. We had maybe 3 people who married Koreans and then kind of divorced them or anyway separated from them. And so instead of becoming like owning their own visa, they're now dependent on their minor child who is a Korean citizen. So the foreign parent's visa becomes attached to the child instead of the spouse. So then once that child becomes an adult, the foreign parent, is expected to leave Korea. So in all these cases, like the one whose family was taking all of her paycheck, and also the ones who became illegal migrants, and the ones who are dependent on their children, their status here is uncertain. So a few of them seem to feel okay with that, but some of them feel very nervous, especially the ones who are waiting on their minor children. Like, when they grow up, where am I going to go? Especially if they want to, if the children want to remain in Korea, maybe I can't stay. So I want to send them to Korean university if that's what they want, but what should I do? So some uncertainty, a lot of uncertainty in all of those cases. A lot of uncertainty going to the hospital, like I mentioned about language, just feeling nervous about doctors kind of accepting my inability to speak Korean, or even if I do speak Korean, maybe I'll make a mistake, or maybe I will have bad pronunciation and they won't understand me very well. Also uncertainty of kind of especially emergency room situations. So one family, they're both American, and they're both teachers, and she was pregnant and went to she was like, I don't know, bleeding a lot or just a lot of pain, and went to the Chosun University emergency room and effectively had a miscarriage. But like a lot of fear in not being able to understand, like kind of being overwhelmed, not sure what's going on. They mentioned that one of the interpreters was there and so was able to help, but at the same time, like from what I remember of that conversation, it just felt like a flurry of activity, not enough understanding what's going on. And the same couple later had a baby, a different baby, not the miscarriage, but a different baby. And they were at their pediatric clinic. And a junior nurse saw what the junior nurse thought was epilepsy in the baby, which the parents had never seen. And so there was like, oh my gosh, emergency, we have to take her to Chosun University again, blah, blah, blah. Like, so a lot of fear, uncertainty, like what's going on, not enough explanation, a lot of like, oh my gosh, this is kind of stressful and that nobody's telling me what's wrong. So too, that then becomes, next time if I have to go, I'm nervous. What if they don't tell me? What if I don't know? What if I don't understand? So a lot of, again, uncertainty about those things.
Communication gap.
Yeah, huge one.
Yeah.
Yeah, a lot of them.
So what advice would you give to foreign or multicultural families living in Korea to ensure they receive healthcare?
Learn Korean.
Okay.
That's the first one.
Most important thing.
Yeah. Second, maybe know the difference between 1차, 2차, 3차, like the size of hospitals. Also bring someone with you, even if they don't necessarily speak more Korean than you, because when you have a medical emergency, you're freaking out. Like, you're nervous, you're scared. And so having someone else who's not nervous and not scared will help you calm down, and maybe they will do better at listening to the doctor or following instructions, not because of language, but just because they're more calm. So take someone with you, for sure, and learn Korean.
Learn Korean. So would you like to elaborate a little more about this different level of hospitals?
Sure.
Yeah.
So as I mentioned, like level 1, level 2, level 3, and we talked about before too, like if you have kind of a referral from a level 1, they're going to send you to the level 2 and then it'll be cheaper for you. They'll have better technology and things like that, but it's longer wait times. What else I'm not sure. What else do you want to know about that?
I think first, if you have any problem, just first go to this level 1 hospital, like small clinics, and if they refer, then go to bigger hospitals.
Right. Yeah. So we talked a little bit about this already. But I guess you can find in Naver what's open now. A lot of our participants felt unsure of where to go because of the time of day, because a lot of it was about emergencies. And so, like 2 a.m. or on a holiday or on a Saturday afternoon, maybe not all the clinics are going to be open. So should I just go to the emergency room? So a lot of them do, but sometimes it's not necessary. So kind of being able to self-triage would be good. And then also using Naver or Kakao or Daum or something like that, a Korean-based map app, to kind of look and see what's open now. There's the 진료중, which means like treating now, kind of option.
On the map.
So you can see what's open now, and then if there's something open on a Saturday afternoon, you don't need to go to the emergency room. You can go to the clinic that's near your house. Like that.
Can you tell something about technology, like maps or there is any app or something to navigate healthcare system in Korea?
Yeah, as far as I'm aware, the best way to do it is with map app, because
so is Kakao is better, Naver is better, or
that's a personal opinion.
Okay.
Personally, I use Naver, but
Okay.
some people prefer Kakao or Down.
Because Naver is a little bit more English friendly.
I have no idea, actually. I use the
Okay.
Korean version, so I don't know.
Okay, but
Yeah.
like in my case, I use Naver in English, so it's easier for me to type and search things.
Okay.
But I think it's not that much available in Kakao Map.
Okay, well, you're the expert on that. I don't know.
I got this like initial
Okay.
experience, so I'm just using Naver.
Sure.
Sometimes I use Kakao Map because there are some more options available in Kakao Map, but we have to type more in Korean. Is there any other app beside this map?
So the map app has kind of everything. Like,
Okay.
So what I would do if it's a Saturday afternoon, I don't know where to go, type in, whatever specialty. Maybe I have a bad headache and a cold and whatever, so I need ENT. So I just type in Ibinukwa, which is the word for ENT in Korean, into the Naver map, and it'll pull up all of the ENT clinics. But then click the 진료중, which means like treating now, open now.
Open now, okay.
And so then it'll show which clinics are currently open. And then I can look and see, like, there are pictures usually, there are reviews from other patients about like the quality of care or their experience with the doctor. Were they kind? Was there a long wait time? Was it easy to park? Or those kind of things. And usually they have like little star reviews. So some of our participants said they rely on those stars because they can't read in Korean. But they'll look at the stars on those reviews to say, oh, like, this clinic is more popular than that clinic. Or like, this clinic only has 5 reviews, but this clinic has 500 reviews. That's probably safer. That's probably better. So some of them depend on those stars.
Like product rating.
Exactly. I mean, exactly.
They get more trust on more rating.
Yeah. That's a huge question in the field of health communication, that like healthcare is becoming consumerism.
Yeah.
Like a patient is a consumer. So should patient satisfaction make or break a hospital, or make or break a doctor, make or break healthcare, like that? So it's an interesting problem for sure. Healthcare as consumerism.
Can you discuss the social aspects of healthcare for foreign and multicultural families in Korea?
Yeah. So, as I mentioned, visa status, or not even necessarily visa status, but how people feel about their visa is kind of important. How people feel about their Korean language ability is really important. Not is it good or bad, but how they feel.
Confident.
Yeah. Or like, I don't speak Korean, but that's okay. Or I speak a lot of Korean, but not enough, is more important than actually having high level or low level of Korean. We didn't talk about specifically their socioeconomic status, but some did mention being on welfare benefits because of their income. That didn't seem to impact their level of care, because you can access the same services at a lower rate, like at a lower cost, if you are a low-income family. So that's one of those things that at least one of the parents has to be Korean in order to qualify for low-income status. If you're both low-income, they're not likely to approve low-income status.
Okay.
But that means that you would pay about like 1,000 won for a doctor visit and 500 won for medication. So that's a huge bonus. That's That's huge help. Yeah, so that definitely, if that didn't exist, I could imagine a lot of our participants would not seek healthcare because they would find it too cost prohibitive, like too expensive. So, yeah, a lot of people also mentioned their communities feeling like they have enough social support or social connection. And that impacts a lot of things. Obviously, mental health, how they raise their kids, or how confident they are about raising their kids. How confident they are getting information, asking other people for information, or also like just feeling assimilated in Korea, feeling homesick or comfortable. So
there are, I think, some social support network for like different countries. I think they also have some connection with hospitals, I think.
Okay, I'm not sure.
Maybe because they have experience with previous people, so maybe they can suggest more about these things.
Yeah, I know, as we talked about, the 2 clinics, but those are not, I'm not sure, basically.
Okay.
Yeah, I know the GIC has a lot of like cultural groups and things like
Yeah,
that,
a
so
lot
that helps. And also the UCC has a lot of kind of
Mm-hmm.
support and things like that. They're obviously super different organizations. I know also I can't remember the exact name of it. There's a Filipino association that helps a lot with like migrant labor issues, especially
Mm-hmm.
about workers' compensation if someone gets injured or dies on the job. I don't know much about the Filipino one. I think there's one for the Indonesian community, but I'm not sure. Yes, there is. There is one for the Indonesian community in Pyeongdong.
Pyeongdong.
Yeah, so it's super far from here, but there are a lot of factories and farms in that area. So aside from those, I'm not sure. But the Filipino one and the Indonesian one are specifically for workers. The UCC works with workers a lot. It's not exclusive to that, but that's their main stuff. And then the GIC is almost exclusively English speaking. And so a lot of English teachers. It's not so much about migrant rights as it is about community.
Yeah.
But yeah, they don't have a lot of association with medical stuff. So.
But still, they can get help from like advice from there.
Yeah, a little bit.
Okay.
For some things, not so much for healthcare
Yeah.
stuff.
Okay.
Yeah.
So how has the COVID-19 pandemic impacted healthcare services and access for these
Sure.
foreign families?
Yeah. So that's one of the most interesting things is how it impacted like labor and delivery, childbirth.
Oh,
We had a couple of families who had one child before COVID and a second child during COVID. And so really interesting to compare one family's perspective of labor and delivery pre and like post COVID. I think maybe 3 families had that situation. And so in each of these 3 families' cases, like, oh man, like giving birth before COVID was so different from giving birth during COVID.
Okay.
2 of them said that they were not prepared for the fact that the mom would be kind of alone during
Pandemic.
labor. Yeah. Because of like everyone has to take a COVID test and everyone has to test negative, and until everyone tests negative, no one can be in the same room.
Yeah.
And so like a lot of confusion about that, and like I mentioned, uncertainty and those kind of things. That was maybe one of the most interesting things related to COVID. A lot of stuff about COVID and school. So not like the primary area focus of my research, but kind of interesting for sure. And a lot about like how community died because of COVID. Like a lot of the social support that they felt they had before COVID went away. A lot of like people that they would talk to moved back to their home countries. So kind of also some people said, oh, I love that everyone wears masks because like, you know, especially the ones who are teachers would be like, oh, my students would always like wipe their hands or like lick their hands and then touch something, and it's so gross. But when they're wearing masks, they don't do that anymore. So pretty funny. So those are some of the main highlights with COVID and my research project. But,
Okay.
Yeah.
So what role does cultural competency play in delivering healthcare services to diverse population in Korea?
So what I wanted to say about cultural competency in Korea was there is none.
Okay.
There is none.
Okay.
It is you fit into the Korean mold of how a patient should be
Okay.
or get out.
Okay.
If you don't fit, we don't like it. Largely because Korean hospitals are treated as machines. And
Pali.
yeah, body. If you gum up the works and if you are a squeaky wheel are the 2 like metaphors that we're using for this phenomena. Just if you make it harder for us to be efficient, you're a problem. Don't make it hard for us to be efficient. And this is completely opposite from how American healthcare is trending right now. Where American healthcare right now is very like, oh no, we have to patient-centered care and we have to like listen to their real values and their real desires. And so there's a huge emphasis for cultural competency in medical training. in Korea, it's yet to become the norm. So a lot of our participants talked about like old school doctors and new school doctors. Some of them used just old and young, but a lot of them did make the distinction of old school is not necessarily old. So, but just, the doctor is more willing to listen to me, more willing to spend time to explain things like that. But majority of them did not consider it cultural competency. They just said young or new school, not culturally aware. So I think that is a huge problem because of the number of migrants coming. Like, I don't know how Korea is going to handle having such a large foreign population without incorporating cultural competency into their curriculum for medical students. I think, like, English education is already really important, but people are so nervous. It's like jammed down their throat and they're not given much of an opportunity to use it in practical settings. And so that also is not enough to be considered culturally competent. Being linguistically competent is not the same as being culturally competent. We had a few participants also say like, autopilot or textbook solution. And Korean doctors very much have like, you have this problem, this is the answer. You have this problem, like very cookie cutter, kind of just giving the same prescription for the same problem, not considering like maybe they don't want that or maybe they don't blah blah blah. So again,
they have some fixed procedure and fixed way.
So some of our participants said, I like this doctor because he's willing to listen to my ideas, or like this doctor understands that I don't like taking so many pills, so I want to go to this doctor every time. But that wasn't the majority. That was just some.
Tell me about some unique healthcare practices in Korea.
I mean, like I mentioned, the kind of autopilot thing. We have traditional Chinese medicine. So that is something that most of our participants didn't really discuss.
About this.
Yeah, and it is something covered by insurance. So if a patient wanted to get acupuncture or those kind of, traditional Chinese medicine, some things are covered by insurance and are relatively cheap. But most of our participants didn't mention it. The ones who did said, it was fine, I like it. And one person said they prefer it to Western medicine, but for the most part, it was never the primary treatment of choice. The person who said that she prefers it to Western medicine also compensates with, does them both. So, but that's something that you wouldn't see in the US as much.
So let's discuss a little about racism or discrimination here in Korea.
So this is not what I expected. When we started brainstorming for this project, the main thing we wanted to figure out was racism, like racial discrimination. And what we found is that it's totally not the case. Racial discrimination is not the thing.
At least in the hospitals, it's not.
Hospitals and clinics, at least from our participants' perspective. And given that we had such a broad range of participants, like socioeconomically and racially, I feel confident to say racial discrimination is not the thing. Language discrimination is totally the thing. 100%. Because again, Korean doctors want things to be efficient, and because of language barrier, they feel like it's not efficient. So they don't like having this problem patient. But if you show like, I'm trying to make it more efficient for you by speaking some Korean, they're like, okay, let's go. Bali. So again, like if you speak some Korean, they're super into it. And if you don't speak Korean, they're frustrated because you're gumming up the works. You're making the efficiency inefficient. So again, not what we expected to find, but it's what we found so far. So, interesting. I think we had two participants, one from the Philippines say like, I'm a bad migrant because I'm the type of migrant Koreans don't want here. And one person from South Africa say I'm a good migrant because I'm white and I'm from an English-speaking country. So I think there is a little bit of the awareness of like socio-politically or geopolitically, like there is a stratum, but that doesn't necessarily play into how doctors treat patients, or at least doctors treat our participants. And so again, like I don't think our participants did not cite feeling discriminated against because of their race or ethnicity in hospitals. They did cite feeling discriminated against because of their language ability. I don't know that that's everyone. I think it's highly likely that cases of racial discrimination do happen, but I don't think it's as prevalent as we might assume.
Mm-hmm.
So
tell me about future research on this topic.
Yeah, so many.
Okay.
So many. So one is that we kind of didn't think about one limitation that we came across. Most of our participants only go to the hospital for things like vaccines, yearly checkups, maybe the dentist occasionally, and emergency room. We only had 3 families with children that had some kind of disability or like developmental delay. And so most of our 31 of our 34 families kind of just went for regular checkups. Only 3 have extensive experience with long-term care or long-term diagnoses. So something for future research would be someone in a residential facility or, someone with a very obvious physical disability that they may feel discriminated against in daily life, which is just not something that our participants dealt with. And so a lot of them, maybe they go to the emergency room, they're hospitalized for a week. In one case, the longest hospitalization was 1 month, but nobody in a residential facility, nobody with cancer, nobody with so a couple of participants with long-term issues, but not a majority. So it would be useful to see more of that. Also, we only studied Gwangju. So I know that there are projects done in other areas of Korea, especially in Seoul, and some for the whole of Korea. But I think it would be really interesting to see more countryside. Do foreigners ever live in the middle of nowhere? Not likely, but if they do, what is their experience of healthcare? Because probably they're going to have a harder time than our participants here in Gwangju did. So it might be worth looking into. And I am hoping to do a longitudinal study. So come back in a year or a year and a half and ask these same families, hey, how was the last year? How were the last 2 years? Give me an update. A couple of our participants were pregnant at the time of the interview. And so, now you have a new baby. Tell us about this new baby, how that changed your family dynamics. Maybe that somebody somewhere visited the emergency room. Also, we had one participant who came to Korea about 6 months before we did our interview. So she had visited an insurance office to register for insurance when she arrived. And so our interview was pretty much just about that. So she talked about her experience in the insurance office at our first interview. And then a few weeks later, she called me and she was like, oh, Maddie, I had my first doctor's appointment, or my daughter had her first doctor's appointment. Can we talk about it? So we did. And that was great. So I'd be super curious to see a year from now, when she's been in Korea for a year and a half, has anything changed? Has she learned more Korean? Has she felt more comfortable going to the doctor like that? So, yeah.
So would you like to explain a little about labor or birth?
Yeah, so when we talked about COVID, there was a little bit about that. And those were some of the maybe most interesting stories. But also Western women like to have a plan.
Okay.
So all of our American, Australian, Canadian, UK participants had a plan before, going into labor. And they expressed this to their doctor. And this is what they want to happen. Maybe please induce me or please don't induce me. Or I want an epidural, I don't want an epidural. Or, once I push for this many hours, I want a C-section or whatever it was. But we're not aware that once you go into labor, Korean doctors don't really consider that because 2 reasons. One, the doctor knows best. So the doctor's just going to do what the doctor's going to do.
They decide what need to be done.
Yeah. Korean patients are very comfortable with just the doctor's going to figure it out. I'm just going to be here to push. Western women do not like that. Okay. And then also the doctor who sees the patients the pregnant women for their prenatal care is not necessarily the same as the doctor who's going to deliver the baby. So if they go to the same hospital, which typically they would, they have a chance of having the same doctor, but it's just whoever's on call. It's not necessarily your doctor. In the US, we keep our, like, the doctor we see for prenatal care is the doctor who's going to deliver our baby. And so a lot of Western women are almost shocked by the fact, like, where's why isn't the doctor here? It's just a random doctor. I don't know this doctor.
They get this trust issue.
Yeah. And most of that seems to be after the fact, where, like, in the moment, they're so caught up in, like, oh my gosh, this is so painful, or I'm so, like, obviously they're giving birth. They're not thinking about that necessarily. But after the fact, it becomes quite clear that they're not happy with that. So that's one issue. Obviously, Choriwan, being a single guy from India, you may have no idea what Choriwan is, but it's like aftercare residential facility for, like, postpartum. So typically for like 1 week or maybe 2 weeks, a Korean new mom would stay here with the baby. The dad may stay there, or he may, like, go home at night, work, come see them. It kind of just depends on their situation. So some of our participants chose to do Joriwan, and some of them did not. And some of them liked Joriwan, some of them didn't like Joriwan, some of them wished it longer, shorter, you know, what have you. And COVID also impacted some people's choices about Joriwan. So that was interesting. Yeah. So,
like, suppose someone in some emergency situation, what would you suggest to them?
Yeah.
Like, what they should do?
Well, self-triage. Is it really bad enough? Do I really need to go to the emergency room?
Okay.
So if you go to the emergency room, just because you're in pain doesn't necessarily mean that they're going to let you be admitted.
Okay.
Yeah. So just be aware of what triage really is. So there are different levels. You can Google that and learn all about it.
Okay.
Yeah. So how serious is your case from a medical standpoint? Not just pain, but also, like, how likely are you to die?
Okay.
So if you're really probably going to die, obviously go to the emergency room. But if it's just pain at 2 a.m, maybe consider waiting until a normal clinic, like a level 1 clinic, is open, maybe 8 or 9 a.m. on a weekday. If it's totally unbearable, obviously go to the emergency room, but consider going to a smaller emergency room, not a big one. And be aware that there's about, it's like 3만 won or so, like 40,000 won emergency management administration fee if you just go. So be aware that it's more expensive than getting treated at a clinic or in, like, a regular hospital department instead of the emergency room, because they want to make sure you're not just going to the emergency room every time because you want help. It should be medically necessary. So also good point about the maps. You should call and ask, is this worth, like, should I come to the emergency room? They can tell you, like, oh, it's not that serious, stay home. Or maybe our emergency room is full, go to this one. Okay. They'll send you somewhere else if they are full. Because then if you go there and you have to wait a long time,
it's not worth it.
Yeah, it's not worth it.
So let's talk a little about mental health. Like, what are the facilities available for this thing?
Yeah, so again, a lot of foreigners are not satisfied with mental health resources here in Korea.
Okay.
I think there's a big question about who should be responsible for providing them. Should that be like a government thing, something provided by insurance? As far as university students go, like, should there be some kind of assimilation training program, a counselor on campus? A lot of the moms had pretty serious postpartum depression. And so because of that, like, what do? You know? And because there are not a lot of resources available in these moms' native languages.
Yeah, it's very difficult.
Yeah. And so a lot of them have to rely on community resources, like mostly friends and family. But some of them feel that even that was not enough, or when they came, they didn't have friends that they felt they could talk to. So obviously that's a huge problem. Some of the cases that people talked to me about were very severe. And so obviously they would benefit from some kind of, like, therapy, counseling type program, just to help talk them through some of the issues. But again, they don't really exist in any language except Korean. Then the ones that do exist in Korean are largely medication focused. And so
not much on counseling.
No, very little, if any at all. So a lot of people, like the people aware of those resources felt that the suggestions for medication were too extreme and not enough like other options promoted or provided. And so sometimes choosing not to take those options. Yeah, and not to take the medication option, I mean.
So would you like to add something more in this podcast? Like, would you suggest something more about for foreign peoples?
I mean, bring a friend with you when you go to the hospital. Yeah, call ahead of time. Like, take advantage of the preventative care that's available. Like, if insurance covers something, get it. Like, do it because it's not that expensive, and preventative care is everything. Like, doing it at the level 1 is way cheaper than waiting until you have an emergency with something. So say, for example, getting your teeth cleaned every year because that's covered by insurance, and it's like 15,000 won or 17,000 won to clean your teeth. But if you like get really bad cavities and need it removed, or like you have really bad decay, or you break a tooth, that's much more expensive at the like emergency dental care level, is much more expensive. So, and that applies to everything. Like, get all of the tests that are covered at the like level 1 hospital. The level 2 hospital is more expensive, and that's when it becomes kind of emergency. So do it before it's an emergency. It's cheaper, it's safer, it's less stressful. Yeah, I don't know.
So like, have a friend when going to hospital. Learn Korean language
if you can. Yeah.
Go hospital at earliest stage when you feel problem. Yeah. So thank you, Maddie, for coming to this podcast, and I think this topic will really help a lot of people. Like, your experience and your research will really help a lot of people.
Thanks for having me.
So with this, we are just ending our podcast.
Cool.
Thank you.
Yeah, thank you.